I'm Katie and I'm here to do my skills validation for my oral medication administration. I have collected my MAR, my Cardex, and my physician's orders. The first thing I'm going to do is look at my patient. Her name's Miley Cyrus. She's a 24-year-old female, admitted for a left total knee arthroplasty. So what I'm going to do first is I'm just going to check my meds because I'm going to do the 9 p.m. or 2100 medication administration. And I see on my MAR that the only drug that I will have to administer is the Aldament, 250 milligrams. So I'm going to check that on the Cardex, and I did find a discrepancy. On the Cardex it says that I'm supposed to give Aldament 250 BID 2 tabs, and on the MAR it only says the 250 milligrams. So I did go in and grab the physician's orders, and it does say 2 tabs. So I'm going to give the 2. Also, what I'm going to do is I'm going to do my first medication 5 right check. So I'm going to make sure it's the right patient, and I see that it's Miley Cyrus, the right drug, the Aldament 250, 2 tabs, that would be the right dose. The right time would be 9 o'clock p.m. and the right route is all her medicines are PO. So I'm going to give them orally. The next thing I'm going to do is I'm going to see to make sure all her lab work was completed today, because she does have a hemoglobin and hematocrit check daily, and so I would make sure that those labs were done and completed, and if I would make sure the physician has the all the information he needed from that lab work. And then I believe I am ready to go into my my medication cart and grab my medicine. So I'm going to go over to the medication cart here, and this is where I will do my second check. And so I'm going to go in and I'm going to grab the Aldament, and I'm going to grab 2 tabs, and these are individually in their own individual containers, so I'm not going to open them yet until I get into the patient's room where I will do my third check. So I'm going to grab a medication cup and my 2 tabs, and this will do my third check. So Miley Cyrus is the right patient. The right drug would be the Aldament 250 milligrams, the 2 tabs. The right time is 9 o'clock, and then also it's orally, an oral medication. So I'm going to grab all my stuff here, and I'm going to then enter the patient's room. Alright, I'll get set up here. I would knock. I would say, "Hi, I'm Katie. I'm here to give you your 9 o'clock meds. This is a antihypertensive medication." So what I would do first is I would check her blood pressure, and if it seemed out of the ordinary, I would then check back to see in her records to see how she normally runs, and then kind of go from there. And I would tell her that this is her Aldament, and it's 250 milligrams, and it's an oral medication, so she swallows it. I would ask her if she's feeling nauseous or if she wouldn't be able to swallow these meds and keep them down at this time. And I would check her wristband and make sure that it is Miley Cyrus, age 24, check her birth date, and she could tell me this also, but this would be my third check. And then I would check on the medication, because they would still be in their individual little compartments, and then I would make sure that they each are 250 milligrams, and I would put them in the cup, and then I would give them to her. And if she could only take one at a time, I would only give her one. I would ask her if she needed them crushed, or if she wasn't even able to take them like that, I would then go and call the physician and see if there was a different route I could give them to her in. And then I would give them to her, they're one at a time or both, and then I would make sure that she's sitting in Fowler's position, because it would be hard to swallow. And then I would give her the adequate amount of water that she needed to swallow them, and I would make sure that she did swallow them. I would do a mouth check and make sure she got them down and she was comfortable with them down. And then the next thing I would do is I see that on her MAR and her Cardex that she has a Milk of Meg 15 milliliters daily PRN order. I would ask her if she's feeling any constipation, and I would check to see when her last bowel movement was. And if it has been a couple days or if she's not feeling right, I would then draw up 15 milliliters of the Milk of Meg. And I would just simply pour that right into a medication cup, and I would give that to her then. And then I would go back and chart why I gave it and how much I gave. And also she has a PRN order for Tylenol. I would ask what's her pain scale, where her pain is, according to her pain scale is a level 4, so I would go and check the MAR and see when the last time she got Tylenol was. She has an order for 650 every 4 to 6 hours, and so if she hasn't gotten it in that time frame, I can go then and give her Tylenol 650. And I would come back 2 hours after I gave her her blood pressure medicine, because I would need to come and check her blood pressure to see how the medication did affect her. And at that time then I would ask her about her bowels, and then I would ask her also about the Tylenol. I would make sure that she's comfortable, make sure the call light's within reach, and I would gather all my supplies, clean up, and wash my hands, and I would let her be for the night. For my next, for the next thing, I would to reconstitute an oral suspension medication. She does not have this ordered, but for any other patient, what I would do is I would grab the medication, and basically with an oral suspension, all you have to do is follow the directions. So it says to add 90 milliliters of distilled water. So what I would do is I would measure out the 90 milliliters. I would pour them in here so that it's 100 milliliters total. I would shake it vigorously, and then I would look at my orders, do my 3 checks, and it says that I need to give 600 milligrams. And according to this, it's 400 milligrams per 5 milliliters. So I would have to give 7.5 milliliters of the medication. And all you would do is draw it up and give it to your patient. And then I would have to put a reconstitution label on here saying that I already reconstituted it with the 90 milliliters of water. I would put the date I did it, the time, my initials, and then I would also put that it is only good for 10 days after I initially opened it, because of the directions it says it's only good for 10 days. And then I would store it according to the directions and my facility's protocol.